We're here with Dr. Jim Fitzgerald from First Chiropractic Centers, and today we're talking about acupuncture. Dr. Jim, can you tell us where acupuncture actually started and how long it's been around?
So acupuncture has been around for quite a long time. Researchers are thinking it's probably 5,000 to 7,000 years old. It is considered to be Eastern medicine, meaning it started over in Europe and the Asia area. When we talk about our current medical system, we're usually referring as to things in the United States as Western medicine. Now, acupuncture found its way over here not till about 1972 when some of the relations with China eased, and we were able to get some providers and other people interested in acupuncture to go over there and learn more about it. So in essence, it's a relatively new form of therapy or treatment in the United States.
Okay, that's good. So Dr. Jim, tell us how acupuncture actually works.
So as I discuss with my patients, because it's a very common question, there's actually three main ways that I always talk to patients about how acupuncture works. So let's talk about the initial one. The initial way is the old Eastern medicine explanation, and that is that we have energy channels throughout our body. And we have 12 main energy channels. If we divide the body in half, we have 12 on this side and 12 on the left side. And those energy channels we want to be balanced. So the theory there is that if these energy channels aren't balanced, it can lead to having symptoms and or dysfunction in the body in those areas. The second way that it works that we talk to patients about is that an insertion of the needle starts this cascade of electrical messages around the body and gets our body to release what's called endorphins and enkephalins. Now, some people know those terms. They sometimes refer to workouts as getting that endorphin rush. And so the way these chemicals work in our body is to help decrease inflammation and to relax muscles. The third way that we explain, and that's been researched here more lately, is that in and around insertion sites, we get a local increase of circulation, which helps to clear the inflammatory products out of the body. And another question that we get a lot of times is well, does it hurt? And most of the time when I have patients in the office and they're a little apprehensive about it, I know that after we talk it through and we do a few insertions of needles, I always go, well, how is that? How did that feel? Vast majority of time they say that they had themselves worked up over nothing, that it was really more comfortable than they thought.
Well, that's quite interesting. So, Dr. Jim, what are some of the conditions that you treat here at First Chiropractic Centers with acupuncture?
So there's a vast array of conditions that can benefit from acupuncture. Probably the most common one that we see are musculoskeletal conditions, whether it's low back pain, neck pain, shoulder pain, or other types of joint or inflammation type of situations. But there's also a group of other things that the World Health Organization says that acupuncture can help with. Just to give you an example of a few, we do have a fair amount of patients that come in here with chronic and or sometimes acute sinus problems, digestive complaints. We even have a couple of fertility specialists that refer couples here to increase their chance of conceiving. So there's a vast array of different conditions that we treat. Also of a little bit of interest here recently is we all know about the opioid crisis, and we think that chiropractic and acupuncture has positioned themselves to help out in that area tremendously. The VA, or the Veterans Administration, has recently been using acupuncture for pain control in the veterans that have chronic health conditions.
Well, that's interesting. So, Dr. Jim, what can people do if they'd like to know more about acupuncture, or if they'd like to schedule an appointment with you or one of the other doctors to try acupuncture?
So we have always had a policy in our office that if you have some more questions, or if you want to find out more about acupuncture, you can schedule an appointment. We consider it to be a consultation. We'll spend some time with you, try to make you more comfortable with what the therapy can or cannot do for you. And for that, we don't charge anything. Of course, if you want to decide you want to proceed with some treatment, we'll discuss fees and we'll discuss treatment plans at that point. I also want to let you know that you can always go to our website. Our website is firstchiropracticcenter.com. There's some links to acupuncture items on there as well. I also want to discuss a little bit about our locations. So I do acupuncture out of our Yankton office and out of our Scotland office. We have other docs that do acupuncture too, Dr. Tom Stoats and Dr. TJ Stoats. Dr. Tom does it out of Scotland and Yankton as well. Dr. TJ can do acupuncture out of our Yankton office and out of Bloomfield. We also have Dr. Lindsay Sievertson, and she does acupuncture out of our Tyndall and our Wagner locations.
All right, well, thank you very much for your time, Dr. Jim.
Thank you very much for listening.